Well, good afternoon. We want to just thank you for joining us today. For those of you who have tuned your webinar channel in, whether you're on YouTube, Facebook, or listening by phone, we want to welcome you to the Healthy Flint Research Coordinating Center, to our 116th session, June 3rd, 2022. We are sponsored today by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Again, we're so excited that you joined us today. We've got really important information that we want to share with you today. I'm your moderator, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. And many of our partners, we wear multiple hats. And so we're excited to have today with us many of our partners who've joined us every week since week number 1. And we're inviting you to put your questions, if you have them, put them in the chat today and allow us the opportunity to respond to some of your questions. We're at 116 weeks. We still have this wonderful array of partners. And I just want to tell you on the webinar today, as panelists, we still have representatives from the Genesee Health Plan, the Genesee County Health Department, the University of Michigan Flint, University of Michigan Ann Arbor, as well as, I think I said the Genesee County Health Department. So those partners, Dr. Reynolds is here. We're going to talk to him in a little bit in our panel, but we want you to know that we look forward to getting your insights. We did a little poll last week, and we asked you some questions about your comfort level with COVID. So we're going to talk a little bit more about some of those questions that we asked last week. But we want to get started today by saying we're looking at some things changing. So we're going to talk this morning this afternoon in our roundtable about turning the corner. And I want to put a pin in it right here and say it's a long curve. So it's not going to be one of those quick turns. We're in for a little bit of a turn. We're also going to talk about what national trends look like with respect to COVID. And then we'll have some updates from our city. And of course, you're going to hear some updates from our Genesee County Health Department. We'd like to recognize this month as being June, being Men's Health Awareness Month. And we want to really encourage our men to take control of their health. And so women, we are more likely and often going to the doctor and seeing about ourselves, even in the midst of COVID. That slowed a little bit, but we are still more likely to go out. So we're going to be encouraging the men during the month of June to take a little bit more action and be concerned about your health, because we need you to be healthy as well. This is also Pride Month, and we want to recognize and acknowledge that there are those who will be celebrating and recognizing this month. And we want to make sure that the health of all of our residents, all of our citizens are kept in mind. So we want to acknowledge that today as well. I want to spend a few minutes with our roundtable this excuse me, this afternoon, and go back to this idea of turning the turning the corner. And what does that mean? When we had our poll last week, we asked those of you about your comfort level with talking about COVID. And most of us are pretty comfortable talking about COVID, but we also have some concerns. We identified some concerns about contracting COVID and long haul. So I want to invite our panelists, Dr. Reynolds, Dr. Wolford. I see Joanne on the line on too as well. Tarnisa, if you would join me, and let's talk a little bit. We had a robust conversation before the webinar began. Some of you might have been a part of that. But here's a question. There was a question last week that talked about long haul. I know we haven't talked about that a lot, but there is a question about long haul. What does that really mean? See, Dr. Reynolds, yes.
All right. Long haul refers to new symptoms that occur weeks after having had a COVID-19 infection. It might be a 2-month window. It could last 1 or 2 months, but it could last longer. It could go away and come back. And here's the challenge. Usually for a disease or a condition, we say you have to have these 3 to 5 things in order to have a diagnosis. We're getting more experience with the concept of long haul COVID so that we can come up with a diagnostic system. And what I mean is, it may be long haul with these symptoms featured, long haul with those symptoms featured. And so we're going to have to figure out how we define it in order for treatment, detection, and giving a prognosis. So, it's sometimes the confusion and mental fog that continues. Sometimes it's muscle weakness that continues. So there may be 5 to 10 other symptoms that we attribute to long haul. We've got to figure out how we'll clump them and how we'll subdivide them.
So it's really important that we continue to get tested, go to the doctor if you have some concerns. Dr. Wolford, this has been a conversation we've had a little bit about with respect to some of the inabilities or challenges in identifying symptoms. So can you tell us a little bit more about your perspective?
So my perspective on long haulers really is that we never know who will get it. I think that's the part that's very, very concerning. So you could have really very mild symptoms and still get long haulers. Now, it's more likely to get it if you have a severe course of COVID, but it does no guarantee if you have a mild case, whether or not you will be able, whether you'll get COVID, so get long haulers. So I think it's a reason for definitely protecting ourselves so that we don't run the risk, because we don't know what will happen to these patients who get long haulers years from now. Will it ever go away? Will it not? Is it doing ongoing damage to the heart and to the other organs that might be impacted? Certainly, it's affecting quality of life. And we do know that in some cases, people who have long haulers but then get the vaccine actually do better. So that's about what we know. And the only other thing one could say from my perspective about being able to cope with it is to be in a multidisciplinary program. So a lot of centers have started long COVID programs or centers where you can get care from doctors from different specialties. So you'll get lung doctors and heart doctors and neurological, those who focus on neurology, all available to help deal with these very concerning symptoms.
So when we talk about vaccines, I know, Joanne, you're out in the community working on a regular basis to encourage vaccinations, because that's one of the layers of protections, as Dr. Reynolds keeps reminding us, is only one of the layers of protection. So what are you seeing? And then Tarnise, I want you to jump in, because I want you to also talk about what you're hearing with respect to vaccines.
So in respect to vaccines, we have seen a dwindling number of people coming to our sites. We offer very flexible sites, times of day, location, and our numbers have been really low. We did a good amount yesterday, like 35 at Shiloh. I was pleased with that. Most of them were boosters. Every once in a while, we'll get a first-time person. It makes us all do happy dances, but for the most part, our numbers are quite down, despite us making ourselves accessible and available throughout Genesee County.
So there's some concerns, and Tarnise, we mentioned this a little bit earlier as we were getting. We know that the numbers are down. So what are you hearing as one of the persons that we say we are the boots on the ground out there talking to people every day?
I'm still hearing a lot of the community residents say that they don't trust the vaccination, and that there's a large enough percentage of people that have been vaccinated. So why do they have to get vaccinated? Some people are still calling the vaccination poison. They're just not trusting the vaccination. And then also there's a concern about the boosters. They keep asking the question is this going to be something that's a lifetime? Why do every 4 or 5 months or every, couple of times do they come out with a booster and saying that they should get the booster? How many times do they have to get the booster shot? So they have a lot of fears. It's just a lot of lack of trust still. We are, as far as the percentage of vaccination, when you look at the percentage, but it's still a lot of Black and Brown residents that have not been.
And so, okay, we lost you. We can't hear you, Tanisa, so we kind of lost you. Can you all hear me?
Mhm. Yeah.
Okay, all right, very good. So can you check your mic, because we definitely want to hear what you said. So this is why we bounce back to the doctors, and we talk about this. We talk about this transition that we're in. This is going to be a long conversation. I know there's been some ebbs and flows, and of course there was some consideration that maybe we would be out of the pandemic, but we're still very much, even though it's slow, we don't hear a lot of it in the media, but we're still very much in a pandemic. Dr. Reynolds.
I would phrase it, we're not turning the corner on the pandemic. We are turning the corner on our behavior, and we're turning the corner on the tools that we have, the layers of protection that we have to prevent serious complications from COVID. How did we turn the corner? We now have antiviral medications, and so far the experience has been good. We had monoclonal antibodies, and if the antibody matches the virus, we're good. But because this virus keeps changing, we still have to go back to our toolbox of wear a mask when you're in a crowd, get vaccinated, and I'll come back to get boosters. And also, if you have symptoms, get tested, or if you've been in a situation where you think it's possible to become infected, get tested and put on a mask till you get your result. So the corner we have to turn is our strategy, our thinking, and our using the tools that are available.
Now, Dr. Reynolds, you mentioned something, and you and Dr. Wilford kind of had a little exchange on this, but you mentioned just before that there is some differences. Now, I had heard earlier, I thought there was a new variant, but you helped clarify to me that we've got this thing now that we're calling subvariant. So can you help us understand what that means? Because we do see more and more people who were previously infected being infected again. How come that happens?
Well, the best example I can do is compare it to family life. You know, we have in-laws, we have outlaws, and we have people in our immediate family. So if someone from your family marries someone from another family, they're combining and making someone with a different genetic background. Whereas within your immediate family, those things remain kind of the same, but you know, not every child is the same in a family. And so in the immune response, not every immune response to this child within this immediate family will be the same. And so we are learning, for example, in South Africa, that they had these within the class, they have had these changes within the family, they've had these changes, and the number of infections took off in the month of May. So we got two things going on. We have variants and we have what we call subvariants, or members of the immediate family. And that's going to be the challenge, being able to detect and be able to come up with the tools to address these problems. But I have to repeat myself, still there are the same basic tools, and those are get vaccinated, because vaccination is the foundation for the prevention of complications and death, and we hope hospitalization, okay? And then wear a mask and get tested, and I'll stop there.
Dr. Wilford, did you want to chime in there?
Sure, absolutely. I think that the point that Dr. Reynolds raises about this subvariant, the variants and the subvariants, and how our body mounts immunity to it, actually has an important role to play in how well getting infected protects you against future infection. So many people would say, oh, well, I got COVID, so I don't need to get the vaccine. But it turns out that depending on which variant or subvariant you were infected by, it impacts how well your immune system protects you against future variants or subvariants. And studies recently have shown that if you get infected that with one of the more recent variants, your protection doesn't last very long, and that the better way to be protected is by what's called a hybrid approach, which is if you got infected, also get the vaccine. That hybrid protection is actually much better moving forward. And I completely want to acknowledge what Nurse T said about people being afraid of getting the vaccine. I think we've all been there at some point in this pandemic, and maybe we are there at one point and we get, sort of more sort of positive thoughts about it, and then we get some more fear again. And it's very natural. After my booster, I got hives and I thought, oh Lord, now what? But I still am so glad that I got that booster because I get the protection from it. But it certainly made me think, oh no, I hope I'm not going to be allergic to this. In the same way I wouldn't want to be allergic to, anything else that one might come in contact with. But so while we have fears, and they are very real and totally understandable, I think it's important to speak with people who are keeping up with the science on this and who one trusts, so that you can get the answers that you need to keep yourself safe. Because finally on this, the idea of saying other people are vaccinated and so that will completely protect me is not totally the case. For some diseases, that is the case, but for this one, it isn't, because the people who are vaccinated are less likely to get the disease and less likely to get severe illness and less likely to spread it. But none of those things are zero. So if you are in the community, you are not vaccinated, you are going to be at increased risk.
Dr. Wolfer, you said something, both of you, this is so important. There are so many questions. We're going to be inviting our community members, just join conversations. There are a number of conversations that are going on in the community where we're looking and identifying trusted, credible voices. And thank you all for being here today. But this will be an ongoing conversation because we're talking about COVID. We've talked about, I see you, Dr. Reynolds, we're talking about COVID, but there are other things that are emerging as well. So Dr. Reynolds, before I go to this other things, I see you.
Yes, and when we talk about prolonged symptoms from an infection, most of us my age have had chicken pox and get shingles, which is a complication of having had chicken pox decades later. And so now we have to have a shingles shot. Also, boosters are nothing new. You could look at a flu shot every year. Because the virus changes, it's recommended that we get another flu shot. But also in just pediatrics, all of us who are up to date have had boosters. And initially, the word was, oh, you're an adult now, you don't need a booster. We changed that song. So we need boosters then. So none of this is new. This is responding correctly to viral or bacterial infection, and the more we know over time, the better our toolkit becomes. But vaccination is still key. Antibiotics and antivirals and wearing a mask and using our brain, all those things are part and parcel of our toolkit.
Thank you, Dr. Reynolds. And one of the things we wanted to mention, we're asking our participants as you're listening, whether you're on listening by phone or your Facebook Live, or you're in the webinar, if you have some questions or concern, please put those in the Q&A. Put those in there so that we can make sure that we bring those issues forward, because it's really important that we get those questions answered for you. So if you're not able to put a question in the queue right now, feel free to email us at info@hfrcc.org. Feel free to email us there at info@hfrcc.org so we can get these questions in. Nurse T.
I just wanted to recap what everybody is saying about being severely ill, is that the vaccination reduces that. So as a nurse caring for patients, we see many patients come in infected with COVID, but now to know that there's a vaccination and there's more discharges than what we've seen in the beginning. So I just want to just put that in the ears of everybody, that it is a great layer of protection and it does reduce us being severely ill.
Yes. So thank you. So as we know, it isn't the end all to be all, and we're acknowledging that, but it is one of the really important things that we're encouraging individuals. Talk to your physician, talk to other families and friends. But if in fact there is something that happens, we talk about adverse reactions, you can report those. And we did have that number, that email address. We'll try to make sure that we put that in the queue so that you know if you feel like you're having an adverse reaction, it's important that you report that. It's really important that you help to inform what's going on, and then we'll be better able to get some of those answers. One of the questions that came up, and I see Danielle here as we're turning and shifting and looking at other issues as well, is someone asked us about monkeypox. And so I asked specifically if we could get some clarification on monkeypox. And Danielle from the health department is here to help us with that. Danielle.
Hi, I'm the chief epidemiologist at the Genesee County Health Department. Just going to talk a little bit about monkeypox, make it a little brief for you guys, but CDC is closely tracking cases of monkeypox that have been recently reported in several countries that don't normally see monkeypox activity, including the United States. As of yesterday at 2 p.m., the U.S. has had 21 cases of monkeypox reported. This isn't the first time the U.S. has seen a monkeypox outbreak. In 2003, there were 47 cases identified in the United States, and that outbreak was actually associated with contact with pet prairie dogs. And that's people were infected after having pet prairie dogs, and they were those pet prairie dogs were infected with monkeypox. Scientists right now are believing that this outbreak across the different countries has been smoldering longer than appreciated. It's been going on a little bit longer. So since 2021, they believe it's been a few months before that even. The risk to individuals is low, and that's what I want to highlight during this talk. Symptoms, just for what people to look out for. It starts with flu-like symptoms, leads to a rash that turns into lesions. Those lesions look like an unusual rash that's similar to a STI, sexually transmitted infection. Most people will have a self-limiting disease, meaning it goes away on its own. The cases so far in the United States have not been severe, thankfully. What we're seeing is it's circulating in countries that normally aren't endemic, where it usually isn't. It's associated, the way you get monkeypox is through very close contact with someone who is symptomatic. This is not COVID-19. Not everyone is going to catch it. It is low risk to individuals. It's skin to skin, mouth to skin, which is different than how we would characterize a respiratory illness like COVID-19.
So now, Danielle, thank you. Would you explain what monkeypox actually is?
Yeah, it's a pox virus. It's very similar in the family to smallpox, which has been eradicated. And this is kind of another cousin of, talking about cousins and family. It's another cousin of a pox virus, smallpox. So
okay. So again, it's not what we call airborne. People are not going to catch it because they're breathing. But there is that close contact. And so
close contact. I mean, you can get it from respiratory droplets, but it's not like COVID-19. It would have to be prolonged, very close kissing, cuddling, areas of lesions, things like that.
Yeah. So thank you,
And right
Danielle.
now, CDC is urging healthcare providers in the US, that's where it's at. It's not at the individual level, it's more at the healthcare provider to just recognize patients who have rash illnesses consistent with monkeypox, regardless of travel or risk factors or their gender or sexual orientation, especially if it's looking like like sexually transmitted infection, and just keeping an eye on that level. And of course, anytime that we hear differently on the transmission patterns or the risk to the county, we'll let everyone know, of course.
Thank you, Danielle. I appreciate you coming on and answering that, because when we hear these things and they really sound frightening, it's important for us to get some good information. So we appreciate you sharing that with us today. So as we continue this conversation, I just want to go back as we close our roundtable today. As a community, we need to remain vigilant. And I think Dr. Reynolds mentioned that earlier, remain vigilant. And I just want to have him reemphasize, along with Dr. Wolford and Nurse T as our key panelists here today, just again, remind us of some of those important steps we need to take in order to ensure that we're improving what we see. Because we're getting to, just had a conversation, we're getting to the fall season and they're concerned, well, summer, we just had a holiday, but summer's coming. People want to get out and about. And so there are some concerns about what happens and the potential for another outbreak if we are not mindful.
I'll let Dr. Wolford go first, please.
Well, just very quickly, I think that while we all want to think that this is going away and we believe we're heading in that direction, that and we are in a better place now than we have been at other points in the pandemic. From a pediatric standpoint, I'd like to note that last week we had over 100,000 cases of COVID in children, compared to the same time last year when there were about 10,000 cases. So you can see we still have a lot of COVID around. And so we do have to do all the things that I believe Dr. Reynolds is going to say. And so I'm going to leave those to him. I think it's very interesting to talk about and to know about monkeypox from the standpoint of realizing that we can have these new or repeat viruses coming up at any time. And so we have to be conscious of this and aware of it, but I wouldn't lose sleep over it at the moment, particularly as we also have some treatments for it, because some of the treatments against smallpox will be beneficial against monkeypox. So there's nothing developed for monkeypox specifically, but because we have things against smallpox that will help us, we are in somewhat of a better spot than we were in when COVID-19 came around. And so while we have to be vigilant about it, I think that there are some positive things in that story to hold on to. With COVID, the positive thing to hold on to is that we know about the layers of protection that will help. And I'm going to leave those to Dr. Reynolds to speak about.
Well, thank you. Remember what your grandmother used to tell you, act your age and not your shoe size. So there's things that we do for people who are 50 and over, or who may be immunocompromised, had an organ transplant, or on cancer therapy. We must use those layers of protection for ourselves as well as for our loved ones, even if we're young and healthy with no problems. So that's something that we should never forget. We do these things not just for ourselves, but for our family, our neighborhood, our households, our coworkers. And we have to keep that in mind. So what are the layers of protection? Vaccination still is prime. And if they come out with another booster in November and say it's necessary, I will be the second person in line, because I'll probably push my mother up ahead of me, and she's 93. But this is serious. And then get tested. If you're in a situation of crowds, or you've been around someone who you think is infected, or you've traveled, it's a good idea to get tested before you leave. But it's also a very good idea when you get back to get tested to make sure you haven't been infected. And you may wait 3 to 5 days in order to get the test. But if you have symptoms, you should definitely be tested. And their testing sites, we're fortunate enough to have testing sites throughout the city, and they're being underutilized. And then wear a mask. Now, I've been in situations where I am the only person wearing a mask, and I don't owe anybody an explanation why I am wearing a mask. You know, if they want information, I'll give them information. Like, I have seniors, I'm a senior, I have seniors in my life. There are people who have medical conditions. I may tell them that if they want to have an intelligent discussion, but do not be intimidated to wear a mask in a public setting when others are not. Wash your hands. Improve the ventilation in your house. That means open the windows when you can. Check relatives when they come visit. You know, you've heard me say before, I have told my adult children before they finally got immunized months later, if you're not immunized, you can't come over here. And that created some issues around Thanksgiving and Christmas, but I have a responsibility for other members of my family, including myself. So, and you don't have to be antagonistic about it, just be matter of fact and make sure people know the rules up front. And if you're sick, don't go visiting relatives. Don't go to the barbecue. Stay home if you have symptoms and get tested. And if you're positive, stick to the isolation. Until you have been symptom-free without using anything for fever. Okay, and if you've been around someone who's positive, go into quarantine. So isolation is when you're sure, quarantine is when you think there might be a chance. And so at least 5 days in quarantine if you have no symptoms. But if you get symptoms, you start counting the day after your positive test or the day after development for those 5 days. And then you may continue to wear a mask through day 10. And then, like I said, people like me, I'll wear a mask whenever I'm in a enclosed or crowded public situation or traveling.
Dr. Reynolds, you gave us a whole lot of information to think about. So I know we're going to have to go back and review this in order to get that. But I'm glad you mentioned, though, about the quarantine, because some of those instructions have changed over time, and we want to be mindful of that. But we talked a little bit earlier, and Dr. Wolford, you may be wanting to mention this. We talked a little bit earlier about the lingering effects of some of the COVID and as a result of the subvariants, in addition to not having all the symptoms that we were originally told about.
Absolutely. Yes, Yvonne, thank you for reminding me about that. I think one of the interesting things or concerning things about COVID is the way in which it changes. Viruses want to do that. They want to change, and they change a lot, particularly the RNA viruses like COVID. Unlike monkeypox, which is a DNA virus, it doesn't change as much over time or as quickly as these RNA ones like COVID. And when it changes somewhat of the symptoms that we see, and it changes when it's most contagious and how long we might be contagious. And so some of the more recent variants are showing that people are testing positive with the rapid test, the antigen, not the PCR, which we know will test positive for a very long time regardless. But this is the antigen test, which we believe tests positive when we are most contagious. These antigen tests seem to be positive for a longer time with the more recent variants. So there's a question as to whether we are contagious for a longer time. So it just gets back to those layers of protection that Dr. Reynolds mentioned, that we should wear those masks if we have a question, and then we should, social distance. It also, one other layer of protection that I want to mention is more at a sort of public health level. and that is surveillance. So I just think it's really wonderful that Danielle is here today and that she can provide us with those data about the number of cases of monkeypox. I remember when the very beginning of COVID, we were hearing about the numbers and we were like, this is nothing, it's not going to come to us, it's somewhere else in the world. And then very, very quickly we learned, oh my goodness, this is going to have an impact on us. And part of what helped us know what was happening is having epidemiologists like Danielle who can follow this science and share it with us. And so I just wanted to highlight the importance of surveillance and following these numbers, because as Dr. Lawrence said, we don't know. There's a lot we don't know about any of all of this. And so having scientists follow the data is so vital for us to be able to protect ourselves in this new and emerging world.
Thank you, Dr. Wolford. And our participation as community, as residents, is to get the testing done. That's part of this in order to help with the surveillance, get tested, get vaccinated, all of those numbers. So if you get vaccinated, that information goes into the Michigan Care Registry. And it's important because when we travel sometimes, they'll ask you, if you go to places, you have to show your vaccine record. Or you have to have a reason why you weren't able to get vaccine. And here's the last point for this section. There are people who cannot get vaccinated. I'm glad you're still here, Dr. Wolford. There are people who cannot get vaccinated. And there are people who have reasons why they will not get vaccinated. So it's important for us to understand that all of us work together to make sure that our community is healthy. So join these conversations, put some questions in. We'll be working to answer those questions for you going forward. What are some of the future issues that you'd like us to address? And you see this great team here. This is a few of the team that's going to help us get these questions answered. So let me thank Dr. Reynolds, Dr. Wolford, Tanisa, Danielle, Joanne, for sharing with us. And we talked about the epidemiologists and the scientists. We're going to hear from one of our scientists that's a part of our team in just a moment here. But I think now, as we're listening to these terms, many of us are going to be what we might call citizen scientists. We may not have that degree, but we're learning this terminology. I've heard more about RNA and DNA. I had biology back many, many years ago, but I'm hearing that again. So we're learning, and so hopefully these terms will help us to be clear in understanding what's going on and then how we can contribute. So thank you to our panel today. And I want to ask Dr. Rick Sadler if he would come and join me and share with us some of the updated data that we have from our data dashboard. Dr. Sadler.
Yeah, hey everybody, good to be here again. So some maybe potentially good data. We saw again for the first time last week that Flint cases dropped for the first time in maybe 6 or 7 weeks. Genesee County saw a more substantial decline than the week before. It is important to note that those decreased rates could be because of the holiday. And just, we got the data a couple of days earlier, so there could be some differences with that, but we'll definitely have a better idea of that next week. It does trend with what it looks like is going on in our region and throughout the state, where there's a decline regionally. So just a quick comment on kind of what's been going on nationwide. We do know now that Omicron has been a bit more deadly than Delta was. That could be due to the waning of immunity from vaccines. It could be that it's more virulent. But what we're seeing throughout the country is that it's useful to think about rates in a couple different kinds of ways. So not just in sheer numbers, but in the direction that they're going. So the rates are currently going up most steeply in some western states. So Arizona, Utah, Wyoming. Rates are highest on the East Coast currently. So that's like Florida, Delaware, New Jersey. Michigan's not really standing out at the moment, which again, is a good thing. And then we've also continued to see highest death rates in lowest vaccinated states. So places like Missouri, West Virginia, and Montana. So relatively good news, relatively hopeful news. I think we also saw a decrease in our testing positivity rate in the last week. So fingers crossed that continues to go down further. So stay tuned for next week.
So Dr. Sadler, I'm going to ask you, as we're trying to make sure we get these terms together, can you talk a little bit more about the testing positivity rate?
Sure. Yeah. I mean, so testing positivity rate just refers to what percentage of people, when they go get tested at a center or a facility, are coming back with a positive COVID test. Now, people who are staying at home and taking home tests, that's not always counted. If they're returning positive tests, if people are testing at home and constantly testing negative, of course, that's not going to be counted either. But generally speaking, there's some kind of consistency from week to week in the mix of people who are being tested at home or never testing and just getting sick or whatever, and people going into the official sites and getting tested. So it's the official testing sites that accounts for that testing positivity rate. And because we make that assumption that there's some consistency in terms of who's going there and what those results are coming back, when the positivity rate goes up or down, it's one way for us to understand, it's another way to think about case rate in a way, because if everybody is getting tested constantly, then that would be a population-wide estimate of what percentage of people currently have COVID. But oftentimes people who are getting tested are either symptomatic or they're traveling or they need to for work or some other specific purpose. And so it's that kind of, it's a little bit of a biased mix of people who are going to get tested. So a testing positivity rate of 19, 22% is definitely high, but it doesn't mean that 19 or 22% of people have COVID. It's just the people who are either symptomatic or traveling or whatever going to that site to get tested.
So again, we're encouraging people, just in, Dr. Reynolds called it cadence testing at one point. It's just on a regular basis, particularly those of us that travel or are interacting in community. This is a good opportunity for us just to get tested so we can know what our status is. Yep. And make sure that we're protecting ourselves and protecting our community. Thank you so much, Dr. Sadler. Any other comments you have for us today?
No, well, just that I actually just got some more free tests myself. If you Google free COVID tests, the government has rolled out, and I'm sure we've mentioned this again, but just bears repeating. There's free tests being rolled out from time to time. And so I think it's 8 tests you can get now. And that was a few weeks ago that came out. So good to have tests on hand at home.
And we get those test kits test and then turn that information, particularly if it's a positive, turn that information into the health department, because that helps us to keep track of where we are as a community. Thank you so much, Dr. Sadler. And that takes us over to the health department. We're talking about them keeping track of things for us. Dr. Sadler, along with MSU and the health department, developed this wonderful dashboard. And we're going to hear from Ashley Herbig today, who is going to give us the updates from the Genesee County Health Department. Welcome, Ashley.
Hi there, happy to be here. As of right now, just to kind of springboard off of what Dr. Sadler said, we are seeing a slight decrease in cases. We are seeing a decrease in referred confirmed as well as confirmed probable, about a roughly 20% decrease. We have a total of 106,150 cases. In Genesee County, you'll see that the larger proportion is in the ages between 25 to 39. As far as hospitalizations are concerned, and this is something that we definitely pay attention to, I watch very closely every day for hospital admissions based on both age and vaccination status, as well as severity of disease. All of these numbers kind of play a key role in our community transmission levels. Moving forward, making sure that we have a full grasp on what our numbers are, so that we can present the community transmission level so that everyone can be mindful of their prevention behaviors as well as prevention strategies, whether it be personal or within an organization, just moving forward and kind of navigating through COVID based on the transmission level. So in our hospitals right now, we are seeing a gradual increase in hospital admissions. Right now, a vast proportion of our hospital admissions are going to be the 80+ age range. We had 155 total COVID admissions across all 3 hospital systems. For the month of May, 52% of those individuals, or 70 of them, were fully vaccinated, meaning they had first and second dose as well as their booster doses in respect to their timeline. This is definitely something that we are watching. In the past, we did see a vast proportion of our hospitalized individuals being unvaccinated or unknown if they were vaccinated. We do have that criteria that we keep in mind. Now we are seeing a shift as of around February, March. We saw a shift in vaccination status, with a predominant population being fully vaccinated and admitted to the hospital for primary COVID diagnosis. As far as vaccination rates are concerned, we have done over 810. I haven't been able to do the count just yet for today. Vaccine clinics through the Genesee County Health Department, as well as with our partnered organizations, Michigan United, as well as the Michigan National Guard, who we are no longer going to be able to utilize moving forward, but was a blessing when we had them. 405,000 plus doses have been given within Genesee County. 84,524 doses from Genesee County Health Department, including our partner organizations, whom, you know, we are very grateful for, because any boot on the ground is a blessing for our community. As of right now, we are still hosting our clinics at our 3 permanent faith-based organizations: Central Church of the Nazarene, Shiloh Missionary Baptist Church, and Our Lady of Guadalupe. As I had said last week, we have switched those clinics to an alternating every other week schedule to reduce any barriers or confusion that may come from having it done and, you know, randomly having an off week between clinics. You know, that does become a little confusing just moving forward. So we do have those mapped out on our website now, gchd.us. Right in the front, there is a button. If there's anybody that has any barriers whatsoever to access our website, we do have that phone number that they can call to get any questions answered. But again, our sites are every other week. We had our first pediatric only clinic, or pediatric clinic, at our Burton location, because we did have our booster guidelines updated for our littles, for all of our tiny humans, so that they can be included into our booster schedule, make sure everybody gets the access to vaccinations that they need. So we still have, like I said, our 3 faith-based organizations, our Genesee County Health Department Burton Clinic location. There is going to be a pop-up clinic at the Pearson Road YMCA on June 11th from 11 a.m. to 2 p.m. That is going to be ages 12 and up. And then we'll also have a pop-up clinic at the Hasselbring Senior Center on June 17th. That's from 4 p.m. to 6 p.m., also 12 and up. We do want to spread the word that our 3 brick and mortar sites, our HANU sites, are no longer offering vaccination for COVID-19 or any other virus, so be it, but they are still doing testing. Again, there are no vaccination capabilities or capacity at any of our HANU MDHHS sites in Genesee County. And those remain as our Word of Life Church, Bethel United Methodist, and Macedonia Baptist Church. As it goes with the messaging, if you have been exposed, please follow those quarantine and isolation guidelines, the timelines that are given in order to get testing, when's the optimal time to get tested based on exposure, whether it be vaccinated or unvaccinated. These are all things that we need to keep in mind and make sure that our testing and vaccination sites are available for everyone. So we still have other testing and vaccination sites at Walgreens on Davison Road, Hamilton Community Health Network, both the North Point Clinic and the Burton Fire Station, as well as our Rite Aid location. We have one in Swartz Creek and one in Flint. Dates and times run respectively for each location. All of this, again, can be found on our website at gchd.us.
Thank you so much, Ashley.
Yeah.
Go ahead. I know you had a little bit more.
Oh, no, you're fine. You're fine. Just to reiterate, if anybody has any difficulties with technology barriers or access, any kind of barriers whatsoever that would prevent them from being able to adequately look at our website, we do have our COVID call center still going, 810-344-4800. We have people on standby to answer any questions. Both English and Spanish is available. We do ask again, though, if you have access to the internet, please do not tie up the lines so that those that need it can use it.
Thank you, Ashley. I just had a quick question. There's a couple questions in the queue, and I know our team in the background is going to answer, but this one segment of how do you know that people are testing positive at home and they're reporting through their reporting to you about their positive home test?
Well, I can take this one, Ashley.
Awesome. Thanks, Danielle.
Yep.
Oh, there's
so,
Danielle.
Yes. So for home tests, they're actually not reportable in Michigan, but the Genesee County Health Department does just take it. We classify them as suspect cases. We know that not all home tests are being reported, but we have a place on our website where individuals can, and we do keep track of it. It's kind of a background statistic that we just take a look at, but it isn't reportable in Michigan for home tests. We just do it here.
Oh, all right. Thank you. So we're glad our health department is taking a lead on that for us here locally. And the other question in our queue, and this is to any of the panelists, is about third boosters. And I know we talked about it a little bit, but what's the plan for a third booster shot for Pfizer and Moderna? And I know, Dr. Wolford, you also mentioned something about the children's vaccines that you wanted to you shared with us last week. But is there a plan for a third booster for Pfizer and Moderna? Dr. Reynolds?
Yes, I would say there is consideration for a third booster depending on what happens over the summer. But yes, there is consideration. There may be a change in the formulation in the vaccine to respond to what's out there, but those things are not concrete at this point. But yes, it would be irresponsible not to consider the third booster because immunity, we have found that immunity wanes or decreases due to this virus. But we've also found out that the subvariants may a specific component in what Dr. Wolford called a hybrid vaccine, where it gets tweaked in order to respond to the change in the viruses.
Thank you, Dr. Reynolds. So stay tuned, more to come on that, because again, remember, we're in a learning process and everybody's voice counts. So your questions or comments are very, very important. And earlier we talked, Dr. Reynolds, Dr. Wolford, and some of our other scientists, epidemiologists, they're studying all the time and reading up on these articles. So your questions are so incredibly important. Your comments equally as well. So thank you so much, Ashley, for giving us an update from the health department. And we do want to hear from the city. And Kiana, wearing a couple hats here, is going to help us to know what's going on, city of Flint. Hi, Kiana.
Hey, good afternoon. All right, so we've wrapped up May, Love Your City month for May, but wanted to say thank you to the community for your participation. We do have some additional events coming up that will be beneficial to beautifying our community. I wanted to especially mention the tire buyback on June 11th. The details are listed here below. There will be a payment of $1 each up to a maximum of 25 tires. So as I mentioned last week, if you want to go through the neighborhood and find tires laying around and collect them, you might be able to turn those in at the tire buyback. So we ask that you let the community know and show up on June 11th to turn in those tires. All right, I just wanted to have the opportunity also to talk to the community about the plan for demolition of blighted structures here in the city of Flint. At the beginning of May, the city held a collaborative press conference with Genesee County along with the land bank to announce that $45.3 million would go into tearing down blighted structures in Flint and Genesee County. And if you look at the breakdown here, you'll see that the majority of those dollars are intended for the city of Flint. So at the time of planning, they were looking to tear down just over 2,000 structures at a cost of just over $34 million. So this is a huge investment in the city of Flint in tearing down both residential and commercial blighted properties. So that plan was approved by the county commissioners at the beginning of May. And the county is beginning to work with the city, the county, and the land bank are beginning to work together to make sure that that process begins of tearing down those properties. Next slide. This isn't a great visual, but it will give you some indication of the areas where properties will be torn down. The initial plan, as I mentioned, included tearing down more than 2,000 properties. There will likely be some adjustment to that, mainly related to cost. We know that we are going through a phase where prices for just about everything have gone up. And so we do anticipate that for this project as well. Just want to make sure that everyone knows. But initially, the goal was to tear down over 2,000 properties in the city. At last notice, there were about 1,400 properties, residential properties, on the list to be demolished immediately. Next slide. And so this was the initial plan of how to move forward from all of the partners, beginning with inspecting properties, making sure to secure the funds, which again, those funds were approved at the beginning of May. So the funds are secured and in place. The Genesee County Land Bank will continue to move forward in their plan and process and make sure that we are all updated on the timeline so that we know when these properties will be demolished in our communities. All right, any questions for me?
Well, I just want to say thank you for bringing this forward, because when we talk about health, we realize health is not just the diseases that we have, but it's also our environment. We talk about those social determinants. It's where we live, where we eat, where we work, where we play, where we worship. And so it's important for us to know some of these other things that are going on in our community that could potentially affect our health. So more to come on that, because we've got some questions about how we should respond when we see all these things coming down. Do we wear additional masks to cover up? Well, anyway, so more to come on that one, Kiana.
Certainly. And I just wanted to speak again to the point that you made. What's happening through this project, we all know that these blighted properties affect our communities mentally as well as physically. And so having the opportunity to finally rid our community of these properties that have been abandoned or otherwise not maintained is a huge deal for us. And I really look forward to seeing properties that have been demolished in my own community finally come down, and looking forward to what comes next in beautifying our community.
Thank you so much. Appreciate that update, Kiana. We just had a quick comment. Dr. Wolford wanted to just make sure on surveillance. We got about 60 seconds, Dr. Wolford, for that comment to help us understand the importance of surveillance.
Thank you so much, Yvonne. You gave me that opportunity already. So it was a comment I made before that
okay.
Danielle here is fabulous for being able to monitor what's happening so we can stay safe.
Thank you, Dr. Wolford. That's what multitasking here. But I want to thank all of you who joined us today for this webinar. We're talking about turning the corner. It's a long curve. It doesn't mean this is over. There's much more to come. We rely on our community to help us understand how to best address this, bringing a local context to a global pandemic. But we know it's just not COVID. There are other issues that our community faces. So we'll be looking, and we have some upcoming issues. We'll be talking about some chronic health illness issues as it relates to COVID. And so we want you to stay tuned and again, get that information to us so we can make sure we respond appropriately. We want to make sure that our social workers understand today those opportunities for social work credits are still there. It's the same with the community health workers to get your continuing education units. Please stay on just a couple minutes, seconds following the webinar so you can get your evaluation and apply for those social work credits. We want to appreciate Michigan State University School of Social Work for ensuring that we are able to provide these social work credits for you, and also again appreciate the Michigan Community Health Worker Association for partnering with us for those CEUs. I must say too at this point, thank you to the community members who really were the impetus or the reason that we're doing this, because you asked for it. We did our best to make it happen. We also want to let you know that every week we're here. You can like us, join us every week, and like us on Facebook. or subscribe to our YouTube channel, Healthy Flint. Please, we continue to ask you, email us any questions that you might have, or if you need more information at info@hfrcc.org. These webinars are available for you to go back and watch on that YouTube channel anytime that you need to, or give us a call at 810-835-2130. And we again will be happy to respond to your questions. At your request, we'll be back here next week for week 117. And I think we're 117 and counting. Someone asked a question, how long? That question depends on what ye say. How long will the information that you need, the questions that you want answered, and your participation is critical to the success of this webinar. We thank all of you for joining us today, and we want to invite you to join us again next week for the Flint Community, the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you for joining us, and we'll look forward to seeing you next week.